IEP Urgent Care Emergency Services Physician, Dr. Jacob Singkoff. Welcome back.
Yeah, thanks for having me. Good afternoon.
Yeah, good afternoon. Dr. Jake's been on the morning show a few times, but this is your first time on the afternoon show.
Yeah, first time. Excited. Not that the morning show's that early, but a little change of pace today. So
you get to sleep in on when you're on this show.
Yeah, I got to avoid the weather maybe a little bit. I don't know how it was this morning, but
it was just wet. Now, Dr. Singkoff is with IEP Urgent Care, and that firm is also the firm that provides the emergency services physicians for Henry Ford Jackson Hospital. So you end up really doing shifts in both places.
Yeah, so I focus my time in the emergency department. We have some people that split time between the urgent care and the emergency room, and I think that's one service we like to provide is, you know, kind of providing that emergency care in the urgent care setting. Our providers are skilled in all sorts of facets, and I think one of the most important skills of someone that works in the urgent care is identifying more emergent diseases or pathologies, so they know when the urgent care might not be the level of care that they need and can escalate to the emergency department. And at that point, they'll call one of our physicians in the emergency department to, say, hey, I got this patient, this is what I'm worried about. And they'll send them to the emergency department at that point. So having that experience level, I think is very important.
Yeah, I think from a patient standpoint, you get triaged right away at IEP, and then if you do need more higher level care, you've got this golden ticket system.
Yeah. So everyone that's seen it in the emergency department, if they need to be transferred to the emergency department for a more specialized testing or treatment, the provider at the urgent care will call ahead. So one of our physicians in the emergency department will be waiting once they get there and know kind of what what workup is necessary or what tests we're worried about. And sometimes it's nothing more than just, hey, I think I need to observe you in the emergency department for a couple hours, where if something if something changes, you're in the right spot to get more quickly triaged or treated. I think it's a great process. You avoid some of the hassles of the emergency department, where wait times, where if you go to the urgent care first, you can obviously always schedule your appointment. And even some of the non-emergent care, such as certain immunizations, sports physicals with spring sports coming up, can be done at the urgent care and in a timely fashion.
Great. I wanted to talk just for a minute about the tragedy last week at MSU. It sounds like Sparrow Hospital was very well trained and prepared for what happened, and that training you've been through. It happens here too.
Absolutely, yeah. So in Jackson County, we have a couple different things we always think about. We have MIS right in the back, right in the corner of in our county. I think part of it's in Jackson County MIS. I think a part of it's in I think 2/3 of it's in Lenawee County. But we have MIS, we have Jackson College. So this is something that's always been on our radar, whether it's these sort of events. So we've done training with in the past. Obviously JCA from an EMS perspective. We involve fire, we involve sheriff, police. Everything like that. And when that tragedy happened last week, we had JCA send up a couple ambulances, and the only reason we were able to do that is they had staff come in, that were not working, weren't supposed to work, were not scheduled, come in, so they could take ambulances up there and ensure that we had enough coverage within Jackson County. So.
That's good to know that this community played a little tiny part of the response.
Absolutely, and I'm so proud of JCA and all their paramedics, EMTs, their leadership, that people would come in on their time off just to provide that, and thank God they weren't needed, but there was JCA rigs up in East Lansing in case they were needed. And I know a lot of the other, if you were watching that night, there was ambulance services from all over the state up there. So Yeah, and it's something we always think about and always prepare for, and hope it never happens. But yeah, we do all those sort of drills in Jackson County also. So.
Yeah, this morning the governor honored and thanked more than 50 responding agencies last week at a special event this morning. So yeah, thanks to all first responders. And they're training even today. Like today, it's a nice storm. You think they'd be very busy. Fire department is actually doing training drills right now, aren't they, Brandon?
Yep.
Yeah.
Yes. Yeah. Especially the rain or shine.
Right.
It's these training exercises. So much goes in and so much coordination. Just the amount of agencies that just participate in the medical care at MIS, scheduling these things is because you get 10 agencies, whether it's police, fire, EMS, from multiple agencies, multiple townships. It's rain or shine with these training exercises.
And when we ask, just 5 times a day, what's the worst thing that could happen? That's what you're training for.
Absolutely.
The absolute worst thing that could happen.
Yep, absolutely. And yeah, we always, in the emergency department, even if you're prepared for it, that's, kind of a, if we're prepared for it, we just hope it never happens. And, hopefully by the luck of preparing for it, it just will never happen. So.
That's great.
Yep.
It's nice to know.
Yep, absolutely.
So we still are in the winter season. People are still getting sick. The flu we're still seeing?
Still seeing, not as much. Same with COVID. Still seeing, but not as much. RSV seems to have peaked too. We're still kind of seeing, my own child has a runny nose now, so we're seeing a kind of probably some rhinovirus, adenovirus, just kind of the tail end of the winter season. Hopefully the tail end of the winter season, I should say, yeah.
So we've seen all these new things. COVID new to everyone.
Yep.
But there are other things that are kind of new that you've never seen before. Unusual viruses that they're just one-off, and
yeah, and I think kind of with with COVID and people isolating, a lot of the time that these children would normally get exposed to these viruses, they're at home or wearing masks. So a lot of children are getting exposed all at once that previously hadn't been exposed. So maybe a 5-year-old's getting rhinovirus for the first time, where before they would have got it when they were 2 or 3. So, so building the immune systems, and we're seeing a lot of kids in the emergency departments, fever and stuff like that, and we're seeing a lot of croup too, which is a virus that causes that classic kind of barky cough, primarily at night a lot of times. So we're seeing a lot of that at this time now. So.
And I think croup is a diagnosis that parents make for, they're not sure what it is. It's just croup. It'll go away.
Yeah.
And some of these things you can't do. There's nothing you can do for them.
Yeah. So croup's one of the ones we actually kind of, even though it's a virus, it kind of causes that classic kind of seal bark like high pitched cough.
Do it for us.
Exactly. Yeah. Worse at night. Can cause fevers also too. So some of the things, if that happens at home, sometimes turning the shower on and breathing in some of the steam. A lot of times even taking your child outside, that cool air will help soothe the cough too. And sometimes if child has labored breathing or something that's called stridor, which is a high-pitched breathing sound that you'll hear kind of almost like a whistling sound when the child breathes in or out. Those are reasons to get evaluated in the hospital, and sometimes steroids, stuff like that, sometimes even observation in the hospital are needed, but primarily it's something that can be treated at home. Recommend, kind of just symptomatic care, staying well hydrated, Tylenol and Motrin for fever control, and then sometimes those trips with that, those tricks with the cough, going outside for some cool air or some steamed air sometimes will help.
Yeah, so one of your little tricks is to just have someone in a treatment room and just keep an eye on them to really see what's going on. Absolutely.
A lot of times in medicine, when they get seen, we're evaluating whether it's a child or any sort of patient at one point in time. A lot of times we don't know if the disease is kind of escalating up or kind of ramping down. And sometimes just a couple hours of observation is important, and that's why we always tell our patients, especially in the emergency department, even the urgent care, where just because I'm seeing you right now doesn't necessarily mean, we hope everything's going to get better, we're going to try, but if things get worse, sometimes that's a natural progression of disease. You need to follow up with your family doctor to make sure you're getting better, or return to the emergency department if these things are getting worse.
Nice.
So, yeah.
So today, with the ice storm expected to get worse, is the IEP urgent care busy today?
I'm sure they are.
Yeah.
I think there was a day last week I was working in the emergency department where there was kind of that ice. There was some ice. There was a little bit of snow and kind of iced over. So lots and lots of falls. So I'm at the urgent care. X-rays. We can do splinting. All that sort of stuff can be performed at the urgent care. So just being careful. Hope not to break any bones, like hips, wrists, obviously falls like that. If you're on blood thinners, hit head, a CT scan might be needed, and that would be more of a emergency department case,
And if you don't know, the best thing is just go and find out.
Yeah, at the urgent care, you can even call and say, hey, this is what happened. Sometimes they can triage you a little bit.
I've done that.
Yep. So it can help. And,
Yes.
and yeah, if it's urgent, if it's something that, might require some x-rays, at urgent care, I think is a great place. Something that might need a little bit of higher level of care. The emergency department, and, no one's 100%. So that's why, you can get evaluated to urgent care, and worst comes to worst, we can call ahead and get you into the emergency department.
Well, we're pretty lucky. We have really world-class healthcare right here in Jackson, and that's I think one of the best things about the community is we have that. So.
Yeah, this is getting back 10 years now, but I went to Michigan State for medical school, and traveling around the state, rotating in different emergency departments, different hospitals, from Lansing to Detroit. The people, everyone we're so proud to serve the Jackson community, and a lot of the resources we have are not found in similar communities, even with, especially around the country, but even within Michigan. So I'm proud to be able to serve the community, and we're thankful to be here.
Well, thank you for being here. And thank you for being here today.
Awesome. Thank you, Bart.
From Henry Ford Jackson Hospital in the emergency department, and from IEP Urgent Care, Dr. Jacob Singkoff. We've got